So let's take a look at what the president said and some of the things Nigerians or some Nigerians expected him to say, and he didn't talk about. Now, he talked about the provision for most vulnerable in the society, saying he has directed that the conditional cash transfers for the next 2 months be paid immediately. This has been on before now. And then he goes on to say that IDPs will also receive 2 months of food rations in the coming weeks. But then the president didn't quite talk about the provision of stipends or stimulus package for Nigerians. There's been a lot of talk about that recently. We've had recommendations and suggestions from individuals. A former vice president talked about, having some form of, stimulus package, 10,000 naira. Some have said maybe 2,500. Well, some say that's too small, so let's have 5,000. But the point is, people have actually suggested a certain amount be paid, not just to, people that were pre-registered under that conditional cash transfer, scheme, but, Nigerians in general. And they look at what is being done in other countries. Take the United States, for example, where citizens will get to be paid a certain amount. The United Kingdom will pay a certain amount during this period, even though it's not meant to start until a few weeks, in the future. But the point is, they looked at those countries and thought that maybe we'll have the same thing here in Nigeria. But, looking through and listening through what the president said yesterday, there was no mention about a provision of stipends or stimulus package for Nigerians.
Some might assume that maybe because it's already been mentioned in some way or the other, in some way or another. So don't look at me like, what are you talking about? But then the question, you may also remember last week we mentioned is the challenge of a database with which that would be, which that could be done. What kind of database would people use? For instance, how many bank accounts do we have in Nigeria? We are 200 million people. How many households have bank accounts? That's perhaps, a challenge. Hopefully this situation will teach us a number of things that we'll be able to adopt and say, going forward, we cannot continue to allow such things to happen. But then you also look at the next one that he talked about. He says, and I quote, "We remain ready to enforce these measures. We should see this as our individual contribution in the war against COVID-19. Many other countries have taken far stricter measures in a bid to control the spread of the virus with positive results." Okay, so on the one hand, no movements, but on the other hand, what happens if there is movement around? There is no, well, of course, he did say that, security operatives have been instructed to follow up and find out, those who need to do something and who need to enforce, the police and all of that. Of course, hopefully we'll be able to explore all of that today. So no punishment for those who flout this decision of movement order. What happens to them?
What law is going to rely on? But just spoke about it.
And that's what the senior advocate said, that, what are you going to stand on? There needs to be a back. And I think these are some of the issues. I understand, like he said, that, this is a time of emergency and we need to take these measures. But those are some of the issues out there.
Well, to speak to direct matters concerning how we're faring in the scheme of things about the confirmed cases, the treatments, what to do, we've got Dr. Chikwe Hekwazu, who is the DG of NCDC. Good morning, and thank you for joining us today on the program. Well, the NCDC, there's this latest confirmation now. All right, so we do have 111 cases so far. So sometimes there are different questions, what we make of these numbers, what to expect in the days ahead. So from what you see, the figures, the facts that you interact with, what do we expect moving forward? Because people think, look, these numbers will keep rising, but to what degree?
So thanks, Chamberlain. Yes, we've crossed the 100 mark, and the reality is that there's a virus circulating in our midst, and that's why Mr. President came up yesterday to speak to Nigerians. In the short term, we do expect the numbers to keep rising, but we also expect that we will be able to get on top of this. And that's why some extra measures were needed. And we met with Mr. President. He took a very hard decision to make the statement he made to institute the measures he did. And if anyone listened to that speech, carefully, you will see that this is really a call on Nigerians to come together and to support these measures. We know that these measures work. There's absolutely no doubt about it, that increasing the distancing from each other, increasing the barriers, keeping our hands clean, eliminating mass gatherings so we're not in contact with each other. We know that these measures work. The challenge for us as a society are the side effects of these measures, and which is why it was very difficult to make. And this is because we know that Nigerians, many people, live from day to day, and they're living every day. So it's not been an easy measure to carry out in the Nigeria's biggest city and Abuja as well. So our leaders had to think very hard, very carefully, make sure that all the measures were in place to support us as we carry this out. So from today, we will appeal to Nigerians to bear the few weeks of pain that will come, stay at home as much as possible unless you really, really need to go out, and let's see whether we can get on top of this. At the moment, there's no vaccine, there are no treatments that work, so our only hope in containing this outbreak is to prevent transmission from one individual to the other. The only way we can do this is to stop contact with each other, which is very difficult and which is why those extra measures were needed. So we need to come together to support each other, especially in Lagos, Ogun, and FCT, where these measures will be intensified over the next few days to see whether we can prevent further transmission of this virus and hopefully get above the curve. These few weeks will also help our teams, the Lagos State team, to have access to the contacts that are living around Lagos, living around FCT. We are following over 6,000 contacts of these 111 confirmed cases across these two cities. Every time we have a new case, we add about 50 to 60 contacts that we then have to follow every single day for 14 days. If we can't do this, if we don't have access to these cases. So this is really one of the reasons, just one of the reasons why Mr. President took this very difficult decision. And it's not just to stop movement. It is to enable us and our teams, the Lagos State team, FCT team, reach the contacts, keep them at home, make sure they're supported, and see whether we can really use this time to buy some time to get ahead of the cases.
Okay, Dr.
Ultimately, we will see that curve start going down.
You did say that there are no vaccines. So could you then tell us, how are you attending to those who are supposed to be, not in isolation, under quarantine, in NCDC's care, in hospitals? How are they being attended to? What's going on at the moment?
So, Chamberlain, really the care provision is the responsibility of the Federal Ministry of Health and the state governments across the country. They've been doing a great job. You can see from Lagos State, from the FCT, from the University of Abuja Teaching Hospital, the Infectious Disease Hospital in Lagos, really doing an incredible job under very difficult circumstances. The principles of care, really, for COVID-19 is to maintain respiratory function as the body recovers. Now, you would have seen and noticed that most of our cases so far have been mild to moderate. We've been fairly lucky not to have had too many severe cases. We unfortunately have had one fatality, which is one too many in our country. The very few number of severe cases. So the role of the clinical care providers is to enable the individuals restore their respiratory function, regain their strength as the virus goes through the system, and ultimately the body is strong enough to clear the virus. At the same time, there's a second very important reason for treating and isolating patients. So for most other diseases, when you come to hospital, diabetes, heart disease, you come only for the primary reason of receiving care for the illness you have. For something like this, you come for two purposes. Firstly, to provide care for you, but secondly, to prevent you from spreading this to others. Because you might have a mild disease, but if you have an elderly parent that you're looking after at home, and you then transmit this virus to that elderly parent who might have certain comorbidities, then he may have the chance of having a much more severe illness than you do, which is why it's very important for you to be outside your home so that you not only have the opportunity to recover in a healthcare setting, but you also prevent transmission of this to your loved ones. The biggest risk for transmission of this virus are two populations, unfortunately. The family, so primary caregivers, people that are in most contact with you, and secondly, the healthcare workers who then have to look after patients when they're in hospital. So we're going over and above to provide these two groups of people the information, and for healthcare workers, critically, the personal protective equipment that they need to protect themselves. So there's a huge effort going on at the moment to make sure all the healthcare workers in those centers that are managing people have the equipment they need to protect themselves, because we need them to survive. We need the front lines to be strong, confident, and competent as they manage these patients on behalf of all of us. It's not an easy process at the moment, but so far we've been on top of it. I will continue pushing hard with all the support that we have received from different arms of government, from the private sector, from really the entire population, society, and organizational structures that we have in our country that have really come together to support the work that we're doing at this critical time.
Do appreciate you and your team and everybody else who's doing a thing or two about all of that. But correct this if it's wrong. As of the 26th of March, we understand that there were about 846 people that you have tested, the NCDC, or the figures of those who've been tested. So what is the latest figure? Because there are concerns as to what's the percentage or infection rate. If we have 111, what percentage and what's the latest figure?
So Chamberlain, we've currently tested well over 2,000 people. We will update those figures today or tomorrow, so we continue to be transparent about those numbers. But we've increased the number of labs in our network to 6. We're activating Abakaliki today, so there'll be a 7th lab in our network. Every day we're improving the turnaround time. We've moved to a 24-hour shift system in Lagos and Abuja, so we're maximizing the opportunity of the equipment that we have, at the same time rolling out new labs. You see, it's the same people doing the testing that are also have to go around the country rolling out new labs. And unfortunately, people can't be split into two. So it's not an easy process to do. We're very focused on increasing the capacity of testing around the corner. If that's one priority that we have as an agency at the moment, it must be to increase the testing capacity. However, to mention too, we are being bogged down by people that do not require the test. So we also have to manage demand. There's no need for you, if you're well, just to run around looking for tests. We really appeal to Nigerians, especially people living in Lagos and FCT. Please, if you're worried that you might have this, stay at home. Isolate yourself, call us if you have symptoms. We will make a plan for you. And we have done this for hundreds, thousands of Nigerians. But what really bogs down the system, when you find people looking for the test, finding a way for samples to be collected, this then clogs the system. We're not able to then test people that we really need to test. And therefore, that's why you're seeing these increasing delays in the system. So we have released a new case definition yesterday, defining exactly who needs to be tested. We will apply this strictly so that as long as we don't have the number of tests that we need, which is the reality at the moment, we're working very hard to increase that. But as long as we have these limitations, we have to focus on those who need it the most. At the same time, work very hard to increase the capacity of our testing, which is what we're doing day and night, and we're really assuring Nigerians through different pathways. There are new test technologies that have just been approved. We've already started the procurement process for that. They should be in the country in the next couple of weeks. So that will then that will really radically increase the throughput that we can have for testing. But at the moment, we are where we are. We will increase the capacity of the facilities we have, and therefore make sure that we are able to offer everyone that needs it the test. But we need Nigerians to work with us. Please cooperate with us. If you're not ill and you don't have symptoms, even if you're a contact, if you're not clinically ill, stay at home until you have a symptom. We've listed them on our website. Then call us. If we can, just ease up the system a little bit and focus on where it's most needed, we will be able to improve the efficiency of throughput. But we need Nigerians to work with us on this.
Dr. Ehekwazu, I have seen statements from individuals, government officials that have come out to say, well, yes, I tested positive, but they keep saying that they didn't show symptoms. But you say that if people don't show symptoms, then they shouldn't be tested. So I wonder, how did they get tested when they did not show symptoms? And you also said that you will ensure that, the criteria for testing will be strictly adhered to. And that's something a lot of people are wondering. How did they get tested when they did not show symptoms?
Thanks, Kayode. It's not just government officials. There are many people that have really pushed very hard to be tested. And, as healthcare professionals, it is hard for those on the front lines to reject doing a test. I'm saying that we will enforce this much more strictly moving forward. In the past, some of these have come through, not just among government officials. It's been across a range of society, private sector, influentials and not. We've had to lower the bar in the beginning because, the demands were so high and there was a lot of anxiety and fear. So, we weren't as strict over the last few days in applying these criteria, but we have to now, because what we don't want, is someone that is ill, infectious, infecting others because they couldn't get tested and be brought into care. So there is a price to be paid by doing these things. So I want Nigerians to understand, when you clog up the system by testing those that are well, those that need it don't get tested. We're not doing our country a favor because those people that need it, that may be infectious, are out there infecting others. And this cycle will continue. So we have now come up from yesterday to be much more stricter in enforcing this criteria for testing and to ensure that we really focus on those that need it. And yes, we need everyone to work with us. Politicians, private sector leaders, ordinary Nigerians. The demand has been from everyone. So I'm not going to single out any single individual on this. Everyone has reached out for this test. And now we're tightening it up a bit, limiting it to those that actually have symptoms. And that is our criteria for testing. So we can find those that are most at risk of infecting others in our society.
All right. When the president spoke yesterday, he mentioned the NCDC a total of 6 times. In fact, your name was one that he mentioned in particular, just to show the work you're doing at this time. And he appreciated you for this. And also, when he was going to make the pronouncement about the cessation, he said that based on the advice of the Ministry of Health and the NCDC, then he announced in Lagos, FCT, and Ogun. But if you take a look at the states and the cases, you see that Oyo State has more cases than Ogun. And it's also close to Lagos. And a lot of people are wondering, why wasn't that movement also restricted in Oyo State, seeing that Oyo State has more cases and it's also a close neighbor to Lagos State?
Thanks, Kayode. I think, the mention of entities is really a representation of all the government agencies, ministries, departments, from aviation to security, from immigration to internal affairs, to the state, federal governments, teaching hospitals. Everybody has come together. And that, I think, really was Mr. President's key message to healthcare workers, public health workers across the country. So we need to keep on that pace. These are not easy times and these are not easy decisions. If you notice from Mr. President's speech, he really tried to pull Nigerians in to assure them that they will be looked after as much as we can. He assured Nigerians that he will try to find the right approach, the balance between these difficult interventions from the reality that most Nigerians live really from one day to the next in terms of earning a living. This situation, like he said at the end of his speech, is being constantly re-evaluated. We have the opportunity to brief him fairly regularly now almost directly with the Honorable Minister of Health, assess the situation, and I'm sure if the situation demands it, he will make further statements and make further restrictions. But let's work with what we have now. The strictest restrictions have been in these 3 states. But also, we are appealing to everyone across Nigeria. I mean, there's no magic on the border between Ogun and Oyo or any other of the states, or FCT and the states around it. Many people working in the FCT coming from Nasarawa State anyway, so they are no better protected than those at FCT. But these are difficult decisions. We always have to understand how hard these decisions are for the leadership of a country where you have 200 million people living, and you have to really think about the impact of every decision on every part of the country. So I am sure the president will reassess this over the next few days, and if stricter restrictions are needed, then he will make them. But the key thing in the president's speech, and like you would have noticed, we're not rolling out the military or the police to ensure that people stay at home. We're really appealing to Nigerians to do this for themselves, do this for their country. Believe that by doing this yourselves, you can save this country from a huge disaster. And that is really at the heart, that was at the heart of the president's speech yesterday.
One of the things that a number of people are also wondering, you alluded to it, the fact that we have 200 million people, and so many people, of course, the Commissioner for Health in Lagos, you would remember, said that there is a possibility that if people do not, stay at home and all of that, we could have up to something in the region of 39,000 people who are maybe asymptomatic and maybe tested positive as well. Now, we are not also unaware that the NCDC is coming up with a molecular laboratory network all over the place with capacity for testing for COVID-19. Could you tell us a little more, give us an overview of what this, the progress made so far by the NCDC about these test centers all across the nation?
So thanks, Ayo. We, like I said earlier, we just activated Ibadan. We have to work with centers that already have a certain level of 2 things. Firstly, the capacity to do molecular testing, so PCR testing capabilities. But secondly, and this is critical, people don't often understand this, have a biosafety environment for testing highly pathogenic infections, viruses. Now, not too many centers have both together in the same place, and it is not easy to set up. So we're working with labs that already have such setups and then activating them with the primers and reagents to make the diagnosis for COVID-19. So we've just completed that in the University of Ibadan Teaching Hospital. They have now joined the network. Today, the Federal Medical Center in Abakaliki, the Alex Ekweme Teaching Hospital in Abakaliki is being activated today and tomorrow. From there, it will be Kano and Kaduna next, and then Port Harcourt, Sokoto and Maiduguri will follow. So this is the sequence. And in addition, we have Jos also coming on stream. So these are the labs that already have these 2 requirements in place, and Jos will take a little to activate. We have a more medium to long-term plan to really have a center in every state in Nigeria. And I think with the cooperation of the governors, I had a teleconference with them yesterday. Everyone is anxious about this. I think we will all be able to have a lab in our state, but we can't achieve this overnight. So we all have to be patient. We have a sample transportation system in place now that can take samples from any state capital in Nigeria to one of the labs that are working. This is in place, and that's why you've seen cases literally confirmed from every part of the country, even where there are no labs. This is because of the efficient transportation of samples that we have put in place until we have a lab in every state, which is ultimately our goal, so we can ensure that every Nigerian can have his disease diagnosed in a state within 24 hours of feeling ill, and that will really expand and the provision of laboratory testing, especially molecular laboratory testing, and lead us towards a much safer health security across the country.
Well, Doctor, how long does a test take?
Yes, so Chamberlain, this is a really critical point. Now, what I call PCR, molecular testing, you do them in runs. One run can take 6 to 7 hours once it starts. You line up a whole series of tests at the same time. You start this run, there are few processes that you have to carry out that you put them after you finish that. I don't want to go into all the technical terms. Then you put it into the PCR machine, and then it runs for another 2 hours. So that entire process from extraction to resulting takes 6 to 7 hours. And once you've started that process, you really can't interrupt it. So we have to plan in every lab how many runs we can do in a day. We've now almost optimized the process to do 3 runs. So because we're working over 24 hours, 3 runs a day. So we bring all the samples from morning and then evening and then at night as well. So by doing this more efficiently, getting more people in, optimizing the process, making sure we really optimize the process of the people, the reagents, and the equipment, keep the power on 24 hours, keep people fed and energized, we are able to now test as many samples as possible. And that's really one of the reasons you've seen the numbers rise, because we're testing more samples, producing more results, and making sure that those people then come into care. Because really that's the most critical strategy we have now in halting the rise of this disease. We have to identify cases early, bring them into care, identify their contacts, isolate them. And by doing this aggressively in Lagos and Abuja, now that we have a little bit more space to move, and in every other state, you mentioned Oyo earlier, we have teams supporting every single state with a confirmed case, has an NCDC, Federal Ministry of Health team supporting them right now to make sure they have the response right, able to save more lives, and able to get on top of this outbreak.
Hey, Doc, how long between the time the testing begins and the time the result comes out? Specifically, how long?
So that depends on many things. It depends on, sometimes we have to, when we have a positive, we have to run it again to confirm. But what we have assured people is from the time the test gets to the lab, we try and get out the results in 24 to 48 hours.
Okay.
We're working very hard to reduce that. So we've had a big backlog over the last weekend. Yesterday, there were many tests in Lagos, many in Abuja. So we've really knocked down that backlog. Our target is to get out results in 12 hours. We're not there yet for every result. We get many of them out in 12 hours, but we're not there yet, because what we can do is sometimes there's a positive, it's borderline, we make a decision to repeat. This is not something you can give someone a result that you're not sure of. And many Nigerians are used to getting, malaria plus, typhoid and malaria and all sorts of ridiculous results, whereas we can't afford to do that with this specific disease. So we're taking extra precaution to make sure that everyone we give a positive result knows he has the disease, and if we give you a negative result, you're also sure you don't have the disease. These are the 2 parameters for every test that we have to be sure of before we give out these results. So that's why it takes a bit longer, especially when we're about to have a positive result. It might take a bit longer to get the result to you, because we need to be sure that when you get that result, the result means what it says on the paper that it is written on.
Just to be clear, because people have asked this question a couple of times, is there a risk of reinfection? So someone is declared, free of a virus. Is there a risk of getting it again, or the person is immune at that point?
So there's a lot that we're still learning about this disease, that the honest answer is we do not know, because you cannot know that for sure until sufficient people have been infected, followed up for a long period of time, and then we know whether there's a possibility of reinfection or not. And you have to stay at risk, i.e. you have to still be in an environment where that virus is actually circulating. There have been a few reports from Asia, but not that many. So I think there are a handful. I've heard about 2 specific reports. But to answer that question with any type of scientific clarity requires time, because it's only with time that we can know if individuals infected now can be reinfected. That requires time, so the honest answer is we don't know. But that also highlights the point, and one of the most critical things that we're now doing. We're setting up a series of research projects in different parts of this response, because a response is not just about doing, it's about learning. And that is one aspect of this. We're learning about the virus, We're learning about people that are infected by the virus. We're learning about the socioeconomic, cultural, environmental factors that enable transmission, and therefore by learning this, we also learn how to interrupt transmission. So as we're responding, we're learning. Science is a very big part of every response, and that's why a specialized organization like the Nigeria Center for Disease Control is critical in protecting any country's health security. And that's what we're building up, and we're calling on Nigerians to support this, not just during this outbreak, not just in the next few months, but in the long term. And every state in Nigeria needs to now put aside a budget for its own health security, because we can't solve every state's problem from Abuja. And I think all the governors now understand this, now more than ever. And we need to work on this in the long term, because outbreaks come, big outbreaks come sometimes years apart, and it's easy to forget by the time the next series of political elections happen. We need to sustain the investments that we're making now over the next 2, 3, 4, 5, 6, 7 years as we build our health security. But the challenge at the moment is to mobilize all Nigerians, all the resources we have in the public, private sectors, from our partners, to face the challenge we have right now.
Okay, let's see how much more we can squeeze in, because we have about just a minute 30 to go. Because we also saw that report that indicated that about 5 to 10% of those who had been pronounced recovered in Wuhan had tested positive again. But you say we'll see what happens to that. Well, tell us, now that there are restrictions in different parts of the country, one, when do we intend to, as they say, flatten the curve so that we know that, yes, we're progressing with our quest to, curtail and curb this? And then, have you received the funds that's been donated here and there by the several people?
Yeah, Chamberlain. So our ability to flatten the curve, like everyone now says, depends on you and I. So we have to work very hard in the next few weeks to carry out the measures that we've all spoken about. These, like I've said, can be very difficult. You only realize how difficult it is staying at home when you actually have to do that for a few days. You realize how difficult it is not having your friends come over, not being able to shake them, not being able to go to church or the mosque or the supermarket or the market. So these are all the restrictions that we have to bear as a society. So how quickly we can flatten that curve doesn't depend on any magic bullet from any government agency. It really depends on how much we as a society, as a people, take this seriously and accept within us to make the sacrifices that we need to make right now. In terms of the resources that are being donated, firstly to say we're very
Dr.
grateful.
My apologies, we need to go to a break. Well, we'll let you respond to that when we come back in a moment. Please stay with us. All right, welcome back. So Dr. Ekwazu, please go ahead and tell us about the funds.
Yeah, so Chamberlain, I was saying firstly, we're really very grateful for the outpouring of emotions and support to the work being done across the country. In Lagos, at FCT, our private sector has really stepped up. In many cases, they're organizing themselves, which is really what we asked them to do, looking for areas to support and going there and supporting them directly. And, to us, that's the best mechanism. We're not actually asking for a lot of transfer of funds into government ministries or agencies. We're asking the private sector, come together, identify problems, organize yourselves, solve that problem. So this is going on across the country to support the efforts being made and the investments being made by the federal government, by state governments across the country. But, I think one most important thing, a message for every Nigerian, Mr. President announced a few measures to support various aspects of our society. The Central Bank of Nigeria has announced several measures, but ordinary Nigerians, there's a lot we can do. We have people at home. Now is the time to really carry out a citizens-led stimulus package. So if you have someone at home, if you know people within your family, your extended network that really are struggling to live every day, please, let's come together. That's what makes us such a great country. Let's come together, identify those people in our networks, in our villages, support them with whatever we can to survive over the next 2 weeks. We know who these people are. there's only so much government can do. So the strength of our great country is our ability to come together and support each other. And this is what will help the rest of us focus on the response. Because once there's any type of disturbance in our society or discomfort from the measures, then even if you bring out the forces to help that, it becomes a problem. So we don't want anything to happen. We need to have the space to work. To have the space to work really depends on how all of us come together to support the people that need it the most over the next 2 weeks to survive these 2 to 3 weeks that we're starting today to enable us do the very hard work that we need to do to control this. Today, Chamberlain, we're sending a surge team to support the work being done by the Lagos State government. This is a joint NCDC, WHO, and AFINET team. They have just deployed to Lagos to really increase the capacity of Lagos State. Lagos is the epicenter of this outbreak. If we can get this under control in Lagos and FCT, we have a small window of opportunity to control this outbreak. And of course, we will not take our eyes off the ball in the other states. So right now, resources have come in. We need to spend it on the right things, and those are the decisions we're making, and we're grateful for the private sector, and we call on more to come in, support your local communities, support the states, support the local governments, and make sure that in every state capital, and that's our goal, that we have an isolation center big enough to contain an increase in cases that we expect to see, support the messaging, risk communication, educating Nigerians on what they need to do, support us as we run around trying to contact every case. There are many areas that you can support, but just send food packs to a hospital where they're managing cases and make sure that the healthcare workers that are working very hard right now get the support they need from every Nigerian. Or if you can't do anything, just call up one of them, encourage them. They need to feel the love of Nigerians as we go through the next 2 weeks and working hard to control this outbreak in our country.
Well, I think it will be a good idea that we may have to just get back to you and see what can do in terms of feeling that encouragement. But many will be looking and hope that they really do use those funds for the purpose that it was donated for. Thank you very much indeed, and well done to yourself and your team for your work. All right, then.